And we know IBS, irritable bowel syndrome, is a disorder of the gut-brain connection. Now we're really appreciating the brain and the gut as being one and the same. We do have a nerve, it's called the vagus nerve, and not everything that happens in that vagus stays in that vagus, right? Because it's supposed to connect our gut to our brain. It's basically the elevator that is bringing up all these neurotransmitters and hormones that are produced in your gut. We make 70+% of our serotonin in our gut. We make dopamine, we make GABA, we make these things that help us feel good, sleep, digest, have great motility. We make them in our gut. So we want to make sure that gut-brain connection is really strong. So if IBS is a disorder of the gut-brain connection, it's usually diagnosed if somebody experiences more than a few days a month of abdominal pain or discomfort or change in bowel movements. But honestly, as a gut professional, as an expert in the gut, I think that living with a diagnosis of IBS is BS, right? I think that there is usually a reason. So like Dr. Mandala was saying, usually IBS comes down to a few different things. There's either something off with the balance of bugs that live in your gut, because we have all this bacteria, we have yeast, all of us have yeast, all of us have fungus, we all have parasites, we all have viruses. They are living in us. They are living in something called our gut microbiome. We have our virome, we have our fungalome, but they're all living hopefully in harmony. And when they're not, that can cause symptoms of irritable bowel syndrome. But I don't want anyone out there to just feel like they have to live their life around their diagnosis, because we can figure out that dysbiosis. We also see disorders of motility. So if there's something off with the way that the bowels are moving, whether that is neurodegenerative disease like Parkinson's, or whether that is nerve damage, whether that came from a traumatic brain injury, whether that is something with our core muscles, our pelvic floor muscles, that will affect the way that we're able to move our bowels, digest our food, and empty them. And then it could also be an issue with your gut barrier. Recently, we became more accustomed to saying leaky gut, right? But technically, it's called intestinal hyperpermeability. That's when the little house, your gut barrier that all these gut buggies are living in, has been damaged. So again, if there's imbalance, think of it as a fire that was raging in the gut. And a fire can cause damage to the structure of a home. So their home has been damaged, and we need to restore that. The way to restore it can seem logically to us to say, okay, well, if the infrastructure is damaged, let me put less in it. Let me eat less variety of food. Let me try to just cut what I'm doing. Let me try to kill, and take different antibiotics and herbs. That will only work for so long until your symptoms then catch up with you further. So if you're out there and you're living with bloat, you're living with abnormal gas, which means you're passing gas more than 15 to 20 times a day, it feels stuck or painful, it stinks, right? You don't feel comfortable passing gas if someone else is near you. That's abnormal, right? If you feel like you're not having a daily bowel movement, that's abnormal. So we're here to help you and really answer all the questions that you have surrounding that. And we know that 14 to 70% of irritable bowel syndrome could be something called small intestinal bacterial overgrowth or microbial overgrowth. It could be overgrowth of bacteria, something called archaea, or fungus. So if we have an overabundance of these things, then we need to help you figure out how to balance them out.
For those of you that don't know, Dahlia was our first patient. She struggled with SIBO and IBS and so many GI problems on a day-to-day basis, hunched over, causing so many other issues. We wish we had a protocol in place, a program in place that led her through step by step, inch by inch, and really guide by guide, so she had everything at her fingertips. Now we have that. That is our Good Gut SIBO IBS program. You can do it 100% plant-based. You can customize it, but it is one of the only programs that is geared towards plants, that can help you customize plants, that can help you tolerate more plants, and really gets to the root of your SIBO, of your IBS, of your ISO, SIFO, IMO, and any other type of overgrowth.